My name is Brian, and I'm an OFW. I'm from Zamboanga City. Uh, I've been working here in Brunei for more than 11 years. So at first, nag-start ako sa under Ministry of Health, and then I was posted in Repas Hospital sa Accident and Emergency Department. And after 9 years, I moved to JPMC. So I started working last 2011 sa Jerudong Park Medical Center as a clinical nurse specialist for emergency department. Yung proximity, isang factor sa akin, yung proximity sa Philippines, kasi at the same time yung culture din. Kasi since I'm from Zamboanga and alam ko ang Brunei is a Muslim country, so parang hindi na ako mahirapang mag-adapt. So, yun yung isang drive sa akin na magpunta ng Brunei compare sa ibang lugar. And it just so happened last time na ito yung available na country. And I'm so happy that I was able to work here in Brunei. Kasi nga, nung una, parang ayoko dahil napaka-quiet, no? Pero nung nagtagal na, parang I feel like this is my second home. In fact, pag umuwi kami, 1 week lang kami sa Pilipinas and have to come back here. Kasi parang dito kasi medyo nakakahinga ka dahil wala masyadong traffic at saka yung gastos hindi ganun kalaki. Clinical nurse specialist, masyadong broad and complex yung pagiging clinical nurse specialist. So aside from managerial thing, I also handle patients. So just to brush up, and not only that brush up, and able to work my profession as a ER nurse. So kasi lumalabas pa rin ako for ambulance call if in case na kailangan ng staff, or even sa pagsusuture. So kasi sa Repas before, I was trained to do suturing and plastering. So I still able to do that here. So yun yung kakaiba sa akin kasi meron akong trainings na nakuha before from Repas kasi ang kakaiba kasi dito sa Brunei is ang kakaibahan ng pagiging nurse dito sa Brunei is you need to do like beyond the scope of nursing practice, like suturing and plastering are not part of the scope of nursing sa atin or in general sa whole world, no? Kasi you need to have a special trainings for that. So, yun yung na-acquire ko sa Repas before. And nung una nga, nung na-assign ako sa Repas, no, nung pinahawak sa akin, oh, you have to do suturing, to suture this patient. Sabi ko, I'm not trained to do that. And, we were taught in college that whenever if you're in doubt, you don't have to do that, to do it. So, well, after that, they were also, surprised bakit hindi namin alam. Kasi sabi ko, that is not really part of our scope of practice. So they trained me good. Meron pa akong Filipino colleagues before na siyang nagturo sa akin. So after that, it's okay. Kahit naman dito sa JPMC, most of the nurses don't do that except myself at saka yung doctor. So kasi they know that I'm trained to do that, to do it. Marami kami. Ang kagandahan lang when you talk about Filipinos, we are so talented and committed sa trabaho. Kaya siguro nagustuhan tayong the population of Filipinos dito sa Brunei is marami. Kasi because of the quality of care that we're giving. Yung being committed and being responsible sa work. Kaya siguro malaki yung edge natin to stand out in our field, So okay naman, yung respect nandun at saka yung trust sa trabaho namin. So basically wala kaming problema. And then sa language din, sa dialect, most of us Filipinos are able to adapt and able to speak the language kasi it's quite easy. So most of the languages medyo magkapareho. So madali mo lang matutunan yung language nila. I think the gain that I will be having is yung respect at saka yung support ng the government of Brunei kasi the relationship between Brunei and Philippines is really strong. Ever since when I came here, I can see that the Sultan of Brunei is really doing his great effort and support to all of us here. So I'm so happy that our president is here.
Okay. Thank you very much, Brian.
You're welcome po.